Urine output assessment consists of measuring the volume of urine produced in 24 hours and evaluating its characteristics. Objective for urine output assessment: to maintain fluid balance. Materials needed: alcohol-based solution, urine collection jar, non-sterile gloves, antiseptic, chlorhexidine, bedpan. For patients with indwelling catheter, aseptically empty the urine into the graduated collection jar by using soaked antiseptic compresses. Once the drainage bag is full, do not allow the outlet valve of the drainage bag to touch the collection jar. For patients who can pee normally, ask the patient to urinate into the bedpan and empty collected urine into the collection jar. Read the volume of urine in the collection jar and note the urine color and odor. Wash hands and document in patient's chart. Normal urine volume in 24 hours is 800 milliliters seconds to 2 liters. Polyuria, an increase in daily urine output to greater than 2.5 liters per 24 hours. Oliguria, a decrease in daily urine output to below 500 milliliters per 24 hours. Anuria, urine output below 100 milliliters per 24 hours. Dark brown indicates glomerulonephritis, hematuria, certain drugs like metronidazole. Dark yellow indicates concentrated urine due to low fluid intake, fever, vomiting, or diarrhea. Orange indicates jaundice, certain drugs, such as rifampicin. Foul odor indicates infection. Calculate the volume of intake either through oral or FOR and compare with the output in 24 hours.